Welcome to the Community Health Program Plan by Vicki O'Banion, RN. My community is located in Leesville, Louisiana, in the east side of Vernon Parish, which is denoted by the red section on the slide. It's also including the state map above. This community is considered a rural area that was formed and established by poor families who were searching for simple country living. The goal of a community health assessment project is to teach students how to apply the nursing process when delivering care to a population or aggregate in a community. First, we had to assess the community's attributes, needs, and desires through a windshield survey, then conduct interviews with key stakeholders and gather realistic data such as demographic and morbidity and mortality rates. From the assessment, students analyze the information, develop a priority list of areas that need improvement, and validate this list with the community members. After validation, the students and faculty, with the guidance of the community members, develop an intervention to address the community's area of concern. In our windshield survey, we had certain topics that we had to discuss. One of the first topics is open space. The open space in the community is where the old houses were torn down and the lots are now left open. The commons is where we have several restaurants that are popular in our community, as well as several bar establishments. During the day, it is mostly lunchtime when people are taking their lunch break with friends, family, or co-workers. Transportation. Personal automobiles are the main way to get from place to place. However, there are some individuals that ride bicycles or walk to where they're going. There is also a local cab company that sometimes facilitates travel. As far as safety, approximately 1/4 of the town is in an area that is common to crime. So in saying that, most of the town is safe. The social service centers are recreational parks scattered throughout the residential areas. Offices of dentists, doctors, and pharmacies are located around our hospital. These are not all the specialty doctors here, mainly general practice, orthopedic, and OB/GYN practices. The stores that we have here contain a Walmart and a Market Basket as the grocery stores in the town. The only modes of transportation are automobiles, bicycles, cab, or walking. There is not a huge selection of retail stores here either. Everyone usually goes to the next big city to shop for everything but groceries, and the next big city is over 60 miles away. Street people and animals. During the day, you mainly see working people during the lunch hour, shoppers on some of the streets occasionally. There is a good animal control officer in this community, so it is rare to see stray animals wandering around. The condition of the area. The main areas around the highways are usually kept clean. However, sometimes out in the residential areas, you can see old rundown houses, trash in some of the yards of the houses, and abandoned cars, equipment, aluminum cans, etc. Race and ethnicity. We are a diverse group of individuals since a military base is near the town. There are a lot of Asian and Mexican restaurants in this area, as well as the normal hamburger and chicken eateries. Within the establishments is where you see the Oriental and Hispanic languages written and posted. We see races and ethnicities from all over the world. Religion. There are a great number of churches and worship centers in our town. Some of the religions include, but not limited to, are Baptist, Catholic, non-denominational, Lutheran, Oriental, and Hispanic. Health indicators. We have a main hospital that houses approximately 30 beds, including all specialty areas. There are 2 dentist offices in town, and multiple family OB/GYN and orthopedic doctors' offices. Politics. Since we are now in election time, I see lots of political signs advertising for election of mayor and council members. Our current mayor is Rick Allen, and the current chief of police is Greg Hill. Media. It is not Media. It is not any indicators of what people read. However, there is a library close to the project area. We do have a radio station on the outside of town, approximately 15 minutes away. Business and industry. The job market is very hard here due to the small community area. As spoken earlier, there is a military base close to the town, but you must have either military or a civil contractor to find work there, as well as a good security clearance. Small businesses are what is found here, except for the Walmart. We have a lot of little mom and pop stores that are from the local people who either live here or live within a close range. Next, you will see on demographic and data analysis. The next slide is my community project, and it's the New Life Crisis Pregnancy Center here in Leesville. New Life Crisis Pregnancy Center is a community ministry that serves pregnant women at all stages of motherhood and their families in Leesville, Louisiana. This center creates resources to aid families with difficulty obtaining supplies for their children, household goods, medical services, and is also a peer counseling center for the community with the service of a registered nurse as director. In my community assessment, one of the areas that I noted that was for the consideration is with young females who are of childbearing age and are at risk for infection related to vaginal and sexual diseases. Bacterial vaginosis is a highly prevalent vaginal condition affecting women of reproductive age and has been associated with serious consequences, including miscarriage, term delivery, nursing implementation or intervention is defined as any treatment based on clinical judgment or knowledge that a nurse performs to enhance patient-client outcomes. Nursing intervention can take any form, some of which are direct care, teaching, counseling, coordination, collaboration, health teaching, and health promotion. This list is not conclusive and must be tailored to fit the individual needs and knowledge base of the patient with adjustment to the plan to create effective intervention. For the purposes of this paper, our focus will be to educate patients on the disease processes of bacterial vaginosis and STDs, as so to reduce the number of patients diagnosed with these ailments that are among the community, but specifically among women of childbearing age who are sexually active. In implementing this plan, several educational meetings spaced at approximately every 2 weeks are being planned at the New Life Crisis Pregnancy Center reception room, where registered nurses will give instruction to the diagnosis of bacterial vaginosis and several types of commonly noted STDs. During this educational process, each patient client will be counseled one-on-one and screened to determine the need for referral to an affiliated physician office for diagnostic testing and/or medication administration. There will be additional brochures or pamphlets made available to all patients that visit the clinic throughout the year in case they were unable to attend any of the educational meetings. Nursing staff, as well as volunteers, will collaborate at least weekly to determine if resources need updating or replacing to meet the demands of the clientele. Written information on disease processes related to nursing diagnosis and resource material that focuses on treating physicians that are associated with the clinic. Each patient visiting the clinic will receive notification of those dates. Plans are also being made to coordinate with the local radio stations and the local television broadcast station to announce the new edition of health promotional education meetings scheduled. Evaluation. This specific care plan will be evaluated monthly to ascertain if teachings are being effective, as evidenced by the decrease in the number of STDs and diagnosis of bacterial vaginosis has declined, with goals proposed to be attained within 1 year from start of the nursing care plan. The requirement to assess the care given may sometimes be seen as an affront to the experience, expertise, and disposition and personality of a nurse. However, measurement of care is essential to ensure that patients are receiving the same level of care despite being cared for by different nurses with different levels of education and experience, and with different priorities and models of working. The evaluation portion of the nursing care plan is multifocal in that data collected concerning the patient must be appropriate and that the problem has been resolved with the anticipated action. If the implementation of the appropriate action was not successful, the interventions must change, the cause must be reassessed, the problem redefined, and the outcomes must be well defined. Evaluation is not only beneficial to that specific patient, but is also important in the development of care plans for future patients. In our case of community, one such change in intervention might be that educational meetings could become more interactive and promote group participation instead of just receiving teachings and pamphlets if the outcomes were not met or did not exceed minimum goal requirements. The nursing process. As indicated by the chart on the slide, there are 5 stages to the nursing process that include assessment of the patient, forming a nursing diagnosis, thinking about a plan of care for this patient, implementing that plan of care, and then evaluating the success of the plan and/or creating a revision of the plan based on outcomes of the patient. Conclusion. The nursing process is important that it ensures a standardization of care that is established from baseline activity that has been assessed by skilled professionals to administer high-quality care. Nursing as a desirable profession is very complex and very involved with patients and their families. We as clinicians must consider that we are not only treating the patient, we are treating their environment, their support group, spiritual needs, emotional tendencies, mental deficits, and of course their physical body. One of any of these components can alter the outcomes of the patient health status, so it is imperative that all things must be considered and not discounted as trivial. The central consideration of the nursing process is that it looks first at the patient and then thinks about the care that is required, rather than deciding what care the patient needs and then looking at the patient and how this might be implemented. The emphasis is on patient assessment, encouraging nurses to identify with the patient's potential and actual health problems. Nurses should continually question the care that they administer so that nothing is missed and a level of high quality care is being given. It takes a multidisciplinary team to care for a patient. It takes a prepared patient to receive care, and finally a multifocal view to create patient success.